Hello friends, these days, yoga is being used more and more in the treatment of heart disease. As you know, heart disease is a very serious condition, and lifestyle plays a crucial role in both its prevention and management. The World Health Organization has recognized that among non-pharmacological interventions, yoga is becoming increasingly popular for heart health. First, let me share with you some yoga poses that are especially beneficial for the heart. Afterwards, I'll talk about a few important studies that have been conducted on yoga and heart disease. Let's start with the first pose, Tadasana, also known as the mountain pose. You can check out images or videos of this pose on Google for reference. Tadasana helps improve posture, keeps the spinal cord aligned, and enhances blood circulation. It stimulates the nervous system, benefits heart health, increases HDL, the good cholesterol, and reduces cholesterol and LDL levels. Overall, it's a very effective pose for heart health. The second pose is Vrikshasana, or the tree pose. This pose is excellent for improving balance and strengthening the nervous system. It helps reduce stress and anxiety, and lowers cardiac strain. Studies have shown that practicing the tree pose can decrease cortisol levels, which is a stress hormone, and it also improves heart rate variability, which is very important for a healthy heart. The third pose is Bhujangasana, the cobra pose. This pose is not very difficult to do, but if you find it challenging, you can modify it to Sapesana. Bhujangasana improves the function of the lungs and liver, increases cardiac efficiency, and benefits respiratory function. According to studies from yoga institutes, it helps control blood pressure, increases oxygen uptake, and assists in recovery from heart conditions. Next is Virabhadrasana, or the warrior pose. This pose strengthens the heart muscles and increases blood circulation. Cardiac rehabilitation trials have shown that the warrior pose significantly improves cardiac output and vascular function. Then we have Ida Matsyendrasana, sometimes called the fish pose. This is a twisting pose that stimulates the liver and pancreas, helping to control cholesterol and improve metabolic health. Research indicates that it's particularly helpful in managing metabolic syndrome and keeping blood sugar under control. The next pose is Dhanurasana, or bow pose. This pose is slightly more difficult and should be avoided by people with severe heart disease, but others can perform it safely. Dhanurasana stretches the back, strengthens the heart muscles, improves cardiac circulation, and increases parasympathetic activity, which is good for the heart. Now, let me tell you about some of the important research studies that have been done in this area. In India in 2004, at the Yoga Institute, a study showed that undergoing a full yoga training program resulted in a 23% drop in cholesterol and a 26% decrease in LDL. These benefits came from practicing a wide variety of yoga poses. In Delhi and Gurgaon, a meta-analysis looked at 16 randomized controlled trials and concluded that yoga led to a reduction of 7.66 millimeters of mercury in systolic blood pressure and about 4 millimeters of mercury in diastolic blood pressure. It also improved triglyceride levels and increased HDL. So friends, research on yoga is steadily increasing. I've always supported yoga, but I want to emphasize that yoga is just one part of a necessary lifestyle change. Alongside yoga, it's important to make dietary changes, eliminate oil, stop eating non-vegetarian food, remove cream from milk. Only then can you truly protect yourself from heart disease. In addition, if you need to take allopathic medication, do so without hesitation. Regular walking is also important. The best treatment is a combination of all these things. Yoga is a key part of the overall lifestyle package for preventing and managing heart disease, and I recommend that everyone include it. Thanks for watching.